Hello and welcome. I'm Pat Challen. I'm a registered nurse at New York Presbyterian Hospital in the Pulmonary Division. We're here today to talk to you about a very serious lung condition called nontuberculous mycobacterial lung disease, also known as NTM. The event is being hosted in recognition of Rare Disease Day to raise awareness of an often overlooked condition, such as NTM lung disease. NTM lung disease is often misdiagnosed because of symptoms are very similar to other, more common lung conditions, such as chronic obstructive pulmonary disease, bronchiectasis, and asthma. I'm joined today by Dr. Darios Symptoms, pulmonologist and professor of medicine at New York University Langone Health, and Dario, a person who's been affected directly by NTM lung disease. We will be discussing signs and symptoms, risk factors, tips for talking to your doctor, and much more. Please note, we will not be talking about specific treatments today. Dr. Darios, could you tell us a little bit about yourself?
Hello, I'm Dorina Drizzo-Harris. I'm a professor of medicine and a pulmonologist at New York University Langone Health. I've been practicing there for over 20 years, and I currently direct our bronchiectasis and NTM center. I am with Dariel, one of my patients who has been living with NTM lung disease.
Dario?
Okay, let me tell you a little bit about myself. I'm retired. My husband and I have been married for 48 years. We have 2 beautiful daughters and 2 terrific granddaughters. As far as my NTM lung disease, I was diagnosed more than 3 years ago in October of 2015. But my journey with my condition began several years before then. Since being diagnosed and through the help of different pulmonologists, I've gotten a better understanding of my lung disease, which in turn has helped me to manage my symptoms.
Dr. Drizzo-Harris, could you explain a little bit about NTM lung disease?
Sure. NTM lung disease is a disease of the lungs that's caused by a common bacteria that we find in the soil and the water. We are exposed to it pretty much every day. However, most people will not come down with NTM lung disease. It mostly affects patients with pre-existing lung diseases such as bronchiectasis or COPD. There are multiple causes of NTM lung disease. However, 80% of the cases are caused by Mycobacterium avium complex, otherwise known as MAC.
Why is it important for people to be aware of NTM lung disease?
Well, NTM lung disease is considered a rare disease. However, it's becoming more common. It's growing 8% each year. This, in 2018, last year, it was estimated that 75,000 to 105,000 patients were diagnosed with NTM lung disease just in the United States. Symptoms can be cough, fatigue, or shortness of breath, and in some cases, an NTM infection can cause severe, even permanent damage to the lungs.
Dario, you said you were diagnosed with this NTM lung disease. Had you heard about it before your diagnosis?
No, I'd never heard about it before my diagnosis. I first heard about NTM lung disease, and bronchiectasis in 2009 when I first saw a pulmonologist. The doctor suspected that I had the disease because of some chest discomfort I was having and an abnormal chest CAT scan of my lungs. But it wasn't until years later, as we mentioned earlier, that I was diagnosed. NTM lung disease is one of the conditions that not everyone knows about, but it's important that we are talking about it today.
Mm-hmm. Doctor, you mentioned that there are certain people who are more at risk for this condition. What are the risk factors?
So risk factors include having underlying lung disease such as chronic obstructive pulmonary disease, as you said earlier, or otherwise COPD, or having bronchiectasis, as in Dariel's case. Those patients are more at risk. In COPD patients, you're at 16 times more likely to have NTM lung disease. And in patients with bronchiectasis, about 50% of them have NTM lung disease. If you're older than 65, we see an increased risk, and that population is increasing. If you have a weak immune system, if you happen to be on chemotherapy or other immune suppressing drugs, it's more common in women than men. And we also know that it's more common if you live in a state that's in a coastal area. 7 out of 10 cases come from those states.
Okay. Once you're infected by the bacteria, doctor, what symptoms would a person have?
So the first thing to note is that not everyone who's infected with NTM lung disease will have symptoms. Many patients can go months, even years without symptoms, and sometimes patients are diagnosed when they're having a chest CAT scan for another reason.
Okay.
Patients often will develop symptoms, or they will have a common cold that doesn't go away that brings them to their doctor asking, why isn't this cold going away? And those symptoms are the common pulmonary symptoms, such as cough, sputum production, fatigue. They can have weight loss. They can have lack of appetite, low-grade fevers, night sweats. They can just have recurrent infections that aren't going away with routine antibiotics, and that may alert them that maybe they should be asking someone about NTM lung disease.
So when you say sputum, you mean they get more phlegm?
Yes,
Okay.
they get more phlegm.
Okay, so Dario, tell us a little bit about the symptoms you experienced that brought you to this point.
Okay, well, I only experienced a few of these symptoms. As I said earlier, I started with a discomfort in my chest, and then I had repeated respiratory infections with a non-productive dry cough over the course of the next several months. When I saw my pulmonologist, he initially thought I had organizing pneumonia, but after some additional tests, he suspected that my GERD and my bronchiectasis were contributing factors to the symptoms I was having. When one of the CAT scans I had some significant changes, it gave me some concern. So after speaking and consulting with my family and getting their support, I decided to seek some more opinions on my disease, and my diagnosis was confirmed in 2015.
I'm understanding that symptoms worsen over time. Many people who are affected with symptoms and respiratory are cared for by primary care physicians. What is your recommendation if someone's experiencing symptoms like you've described and they're concerned? What should they do and who should they see?
So if you think you might have NTM lung disease, or that a loved one might have it, or if you're having chronic pulmonary symptoms, the first thing to do is to go to your primary care doctor and ask them to refer you to a specialist in pulmonary disease, someone who knows the lung and can treat lung infections. And there may be pulmonologists in your area that are also specialists in NTM lung disease and things like bronchiectasis. In certain parts of the country, infectious disease specialists may be able to treat NTM lung disease.
Dario, what kind of doctors did you see when you developed these symptoms?
Well, I initially saw my primary care physician who referred me to a pulmonologist. I ended up seeing 4 pulmonologists in all, and Dr. Darios Harris was one of them. And since I've seen her, she referred me to a gastroenterologist who specializes in treating people with GERD, and he was able to narrow in on medications that would help with the GERD symptoms I was experiencing. Even if you've received a diagnosis, it's important that you continue discussions with your doctors in case you have ongoing symptoms or your CAT scans are changing.
Doctor, if a doctor suspects or a physician suspects a patient they're caring for has NTM lung disease, is there a test, something they can do to test for it, and what can they do to treat it?
Well, in addition to a thorough physical exam and a good medical history, in order to diagnose NTM lung disease, you need to have sputum cultures sent to the lab to identify the bacteria. And often that has to be multiple sputum cultures because it doesn't always grow the first time.
Right.
In addition, you need to have, as Dariel did, a chest CAT scan. Often chest x-rays are not sufficient to diagnose this disease. And you asked me about treating the disease. If you are diagnosed with NTM lung disease, you'll want to speak to your doctor about treatment. You want to make sure you're with someone who is comfortable treating NTM lung disease. You will start with working on managing the mucus. Most patients have increased mucus, so airway clearance is one of the parts of therapy. And there are a number of ways we can help patients with airway clearance by giving them some medications to inhale, and we give them some devices to help increase their cough. So those things will help with clearing the mucus. And then often patients will need to go on treatment. And unfortunately, for treatment in this disease, it requires multiple antibiotics. We use a guideline to help us determine which antibiotics should be used in which patients, but antibiotics usually have to be continued for 12 to 18 months.
Okay, that's a long time.
Yes.
So this is a chronic illness.
Yeah.
And it requires some lifestyle changes, I would think, on a patient's part. Could you talk a little bit about that?
Absolutely. So in addition to the airway clearance and the antibiotics, if a patient is on them, we recommend daily exercise. Exercise is a great way to help with airway clearance, a healthy, balanced diet, and of course, we recommend that patients don't smoke if they are smoking. But since this is very common, this bacteria is very common in the environment, we recommend lifestyle changes that involve the environment. So that may mean increasing their hot water heaters to higher temperatures, to 130 degrees, to kill the bacteria more efficiently. It may involve reducing the number of showers they take. It may involve changing their shower heads so that they use ones with larger holes so there's less aerosolization of the water. We recommend changing your water filters based on the manufacturer's instructions. We recommend avoiding humidifiers if at all possible. And we often recommend boiling water for more than 20 minutes and then using that water to drink in order to kill any mycobacterium that will be in the water. So there are a number of things that we recommend that patients do on a daily basis.
Dario, tell us a little bit about the changes you've made in your lifestyles and how this NTM lung disease has affected your life.
Okay, well, I've made several changes. And after following with my pulmonologist, they implemented treatment plans to better manage my symptoms. And these, like Dr. Darios Harris said, include airway clearance and medications, and soon to start some cardiopulmonary rehab. The other lifestyle changes I've made are diet, as Dr. Darios Harris mentioned. I try to follow a well-planned diet and avoid certain foods that they restrict and avoid certain foods and liquids. I carry my own bottled water wherever I go. I try not to, even to restaurants. I cook with purified water. I also eat my largest meal earlier in the evening and try not to lie down after it. I also sleep with the head of my bed elevated. I do, as Dr. Darios Harris said, take shorter showers. I shower every other day. And I've now switched to washing my hair in the sink instead of the shower because, as she has mentioned, the bacteria can be found in shower heads. When I do very little gardening, but if I do work outside with some plants and flowers, I wear a mask and I try to make sure that the soil is moist so I don't inhale any of the dust from the dry soil.
This is a chronic illness. It requires, as you've both said, real lifestyle changes. As a person who's a patient with this chronic illness, tell us a little bit about how you communicate to your physician your concerns and how you've learned to manage your illness.
Okay, well, when I first heard I had NTM lung disease and I reviewed the abnormal CAT scan from my first one, I had a lot of concern. I was a little taken back by it, and I had a lot of questions. A few of the questions I asked were, how did I get the disease? Is the disease hereditary? How I knew I was going to be looking at possible PET scans in the future, and I wanted to know how frequently they might be done, because I was concerned with some of the radiation that you hear about, but I was assured that the radiation is low dose. My biggest advice to people and to our viewers is to be your own advocate. The disease is often misdiagnosed or not diagnosed at all. So you have to be proactive. You have to sit down, talk with your doctor. You need to ask a lot of questions and take notes. If you feel you need somebody with you, have somebody go with you. It's a disease that's going to be ongoing. You will have periods where you feel worse, and it's important you keep an ongoing relationship with your doctor. I sought out three different opinions in my situation until I got a final diagnosis. Probably about 3 years ago, I decided I wanted to start seeing somebody closer to home. So I did some research online, and I found out that NYU had specialists who treat NTM lung disease and treat bronchiectasis, which led me to seeing Dr. Darios Harris. So I've now been seeing her since 2016.
Dr. Darios Harris, what would be your recommendation to people that are watching us today in terms of learning to manage?
So my recommendation is to talk to your current physician. If you're having chronic pulmonary symptoms, or if you feel like you might have NTM lung disease, you need to be referred to a specialist who knows about NTM lung disease. So my recommendation is to ask your primary care doctor to refer you to a pulmonologist. And if in your area there may be pulmonologists who specialize in NTM lung disease, then you might consider going to see one of them. So that's extremely important that you're dealing with someone who knows about NTM lung disease, because it is a rare disease.
Right.
The other thing is to educate yourself. To go to there are some very good websites. You can go to aboutntm.com to start gathering information. Make a list of questions for your doctor. There should be an interaction between you and your doctor. Doctors like to sit with you and answer your questions. It's a very important part of my relationship with Dariel, and it actually, I think, helped us get to the final diagnosis, knowing that she had NTM lung disease. So that would be my recommendation. And then also looking for patient advocacy groups. In New York City, there are a number, so we refer our patients to a number of the different groups here. Ask your physician what groups are in your area. You can look online to find sites from some of the websites as to where there are advocacy groups.
Well, thank you both. Dariel, thank you very much for sharing your experience with the
You're more than
NTM lung disease. That's rare, but it's not rare but when it affects you. And Dr. Darios Harris, thank you very much for sharing all of your professional information. We hope that you learned a lot today and that we seek your feedback and your questions. Remember, if you need to discuss this with your physician, become educated, become your own advocate. AboutNTM.com is an important place to go. If you'd like to rewatch this discussion at a later time, you can find the link on the COPD Foundation Facebook page. We thank you again, and we wish you well.
Thank you.
Thank you.